I welcome you to the Healthy Heart, Healthy Life Pune session 18, which concerns hypertension or high blood pressure. I'm Dr. Neelkant Karandikar, Senior Cardiologist from Pune. You can view my attachments in this slide. Recently, there was World Hypertension Day on 17th of May. And after that, I have started this series on high blood pressure, a very, very important series for all of us because 1/3 of the adult population in the cities suffer from or do have high blood pressure or hypertension. Today, let us look at some very, very interesting historical perspectives. It was William Harvey, 1578 to 1657, that is so many centuries ago, published a landmark work in 1628 where he assumed a driving force for the blood to circulate in the body. And you can see in the diagram, this is the left heart and the right heart, and from both sides, from the left heart on the in the aorta, and on the right side, the pulmonary artery, the blood is pushed, and it exerts a pressure on the arterial wall, and this pressure is called blood pressure because it is exerted by the blood on the walls of the arteries. So naturally, it will be called blood pressure. After the initial uh, discovery by Harvey that it is the heart which is responsible for circulation in the body, and heart pushes out blood which exerts the pressure. The next very important contribution was by Stephen Hales, 1677 to 1761, again many centuries ago. A clergyman with interest in science convincingly demonstrated that the level of blood pressure in a living animal is pulsatile in nature, pulsatile, and of considerable force. He presented information or data in 1769 with a very, very interesting experiment. With the help of his assistant in a horse bound to the ground, as it is shown in this picture, he inserted a glass cannula into its carotid artery, which we have seen is there in the neck. So in the neck of the horse, this glass cannula was inserted, and he showed the pulsatile nature of the carotid blood flow. See, this cannula is a very tall cannula. He had to stand on a stool or a bench, and this cannula is actually this big, but the blood is coming here, and it just goes up and down, up and down, up and down, showing the pulsatile nature of blood in the arteries. Then came Scipione Rivarossi, 1863 to 1937. A creative Italian doctor, Rivarossi, developed the sphygmomanometer, a simple and user-friendly device with some modifications. It is still in daily practice today. However, he could feel and measure only the systolic blood pressure with his fingers. So, this is a cuff of that instrument which he developed. This is wrapped around the person's arm, and there is mercury in this instrument. When this cuff gets inflated, this mercury rises. As the pressure in the cuff rises, the level of mercury rises. And he would keep his hand on the radial artery and or any other artery like carotid or brachial, as it is called, and with gradual reduction of pressure in this sphygmomanometer, he would detect the systolic blood pressure, that is the upper level of blood pressure. Then came a big discovery by René Laennec in 1815. You know, René Laennec, this very good physician, celebrated physician, did not like the idea of putting his ear on the chest of his female patients, and therefore he developed what he called as a phonendoscope. And this is the phonendoscope which he developed. One end is placed on the patient's chest, and the other end, the physician will put his ear onto it. And which did not go around the neck like the ones they have today. So with this phone endoscope, you would hear the heart sounds. So this stethoscope was developed, and the modern stethoscope looks like this. These are the earpieces in the two ears, then the tubing, and then this is the chest piece. Now, what is the importance of this stethoscope in blood pressure measurement? This stethoscope is required to be placed on the artery of the person, and this cuff of the blood pressure instrument is wrapped around the arm of the patient. The mercury is used in this BP instrument, and the mercury level is made to rise, and then slowly it is brought down. You must have seen your BP being measured by a doctor. He inflates the cuff, the mercury rises, and then slowly it is brought down. Now it was Nikolai Korotkov in 1874 to 1920 was his lifespan. He made a very important discovery. He discovered what is called as a systolic and a diastolic pressure. He showed that when you inflate the cuff high and then you put the stethoscope on the artery, and when you start bringing the mercury level down or the pressure in the cuff down, at certain level, the sounds start being heard. These are called as Korotko sounds. When they start being heard, that is a systolic blood pressure, and that is shown here. And as the pressure comes down, at one point, the sounds stop being heard, and that is a diastolic pressure. And therefore, if you say that somebody's pressure is 120 by 80, then the systolic pressure, where the sounds you start hearing, the doctor starts hearing, and when he stops hearing, it is a diastolic pressure, 120 by 80. So this is the history of how, blood pressure was measured initially. Now, as regard the BP measurement is concerned, usually it is measured by the doctor in his office or in his consulting room. And ideally, two readings have to be taken 5 minutes apart in a sitting position. But this is many times not done. Then what can you do is make the person or the patient relax for 5 minutes and then take the blood pressure. And that we're going to see in the next session how the blood pressure is measured. Now, ideally, if you want to most accurately measure your blood pressure, then the most accurate method would be putting a needle or a cannula catheter in your artery and directly measuring the blood pressure on a monitor. But this is not recommended at all on a routine basis. And what is actually done is blood pressure measurement in using one of the three devices. The old device is the mercury manometer. You can see it here. This is the mercury manometer. I don't know if you can see it. No, not very easy to see. Let me see if I can show this to you. Okay, no, it's not possible. Anyway, this is the mercury manometer, and this is the cuff. And this is wrapped around the patient's arm, and the blood pressure is taken. The next type, which you might have seen with many doctors, is the aneroid type, where there is no mercury, but the pressure is measured in this round apparatus, the BP apparatus, and this will show you the systolic and the diastolic pressure. And the more modern machines are the electronic machines, and these also will measure the blood pressure quite okay, accurately, systolic and diastolic both. Selecting the most accurate blood pressure, the cuff, is very important. Whether you're using the mercury, the aneroid, or the electronic device to measure the blood pressure, the cuff is very important. The length of the bladder should be at least 80% of the circumference of the arm. Now, this particular cuff, I'm showing this here. This is the cuff. Oh, it is not coming very well. Anyway, this is the cuff. It is a piece of cloth. And when you wrap it around the arm, it should cover 80% of the circumference of the upper arm. This is the part of the arm which is covered. The width of the bladder should be approximately 40% of the circumference of the arm. So, we have seen that the cuff-based measurements from the 16th century was the mercury manometer, a combination of an inflatable arm cuff, stethoscope, and mercury-based scale. Now, these are not recommended nowadays because the instrument falls and the glass breaks, and if the mercury comes out, mercury is a very toxic substance, and therefore these are not recommended nowadays. Electronic ones are very commonly used. The aneroid ones, which I showed you in the last slide, are sometimes used in many of the doctors' clinics, but the more often the electronic ones are used. And several new devices are also coming: smartwatches, skin patches, bracelets, etc. These Omron machines, a smartwatch, phenometer, port tapes, and smartwatch again, InstaBP application. These are not being routinely used. And this is maybe in the future, these things will become routine. Now, let me tell you that in today's scenario, normal blood pressure is considered as 120 by 80 or lower. 120 to 129 systolic with 80 or lower diastolic is called elevated blood pressure. Stage 1 is 130 to 139 systolic and 80 to 89 diastolic. And stage 2 is 140 by 90 or higher. And hypertensive crisis is higher than 180 by 120. This is an emergency, urgency, and it has to be tackled very, very fast. So we have seen, ladies and gentlemen, today some historical aspects how blood pressure development, blood pressure measurement developed in the past. How that horse was tied down to the ground, and then the carotid was, glass cannula was put in the carotids. From those days onwards, in the modern times, we have very, very modern equipment available. And next time, we're going to see how the blood pressure is measured, how you are going to take care that you do certain things and don't do certain things before your blood pressure is measured. That will be my topic next time. Thank you very much for attending. If you're subscribed to my channel, I'm so happy. But if not, do subscribe definitely. Give me a thumbs up so that I feel encouraged to bring more and more interesting information to you. And tell about my channel to your friends, relatives, and acquaintances. Thank you again, and thank you very much.